We now move on to the Disability Rights Commissioner, Prudence Walker. Is Prudence online?
Kia ora.
Kia ora. Prudence, you're probably very familiar with the way this works.
Yes.
Welcome to Health Select Committee. I'm Hamish Campbell. I'm chairing the subcommittee. We have allocated 10 minutes for your submission. We have got your written submission. I'll hand that time to you now.
Kia ora, thank you. Tēnā koutou katoa, I'm Prudence Walker, the Disability Rights Commissioner at Te Kahui Tika Tangata, the Human Rights Commission, and I'm joined by Senior Advisors Francis Anderson and Brittany Peck. My role as Human Rights Commissioner is to improve human rights outcomes and help Aotearoa New Zealand meet its obligations under international law, and in my particular mandate, the rights of disabled people. As the Minister of Health for Mental Health has said, this is a once-in-a-generation opportunity. This is the first time we have a dedicated Minister for Mental Health. This is the time to make real change. Because the bill simply tacks on ideas to the existing structure, it increases complexity, yet fails to advance those rights in a meaningful way. We need to start afresh. I do want to recognise that many people who have worked to get the bill to this point, I know that the deep sense of responsibility and commitment to making people's lives better that they have brought to this work and how much it matters. And this bill really does matter to our parents, our children, our siblings, our friends and colleagues who are the hundreds of thousands of people it will touch over its lifetime. It is not enough to just try to improve the current system by way of piecemeal adjustments, especially to people with lived experience who have been harmed by it. And the data shows that that is disproportionately Māori. We all want to build communities and systems that support our loved ones when they are in distress or crisis. Systems that support whānau to be able to support whānau and keep us connected with our communities, that support our dignity and that value and protect the identities that are core to our well-being, particularly as Māori, as Pacifica, as Rainbow, women, and as disabled people. This bill needs to live up to the name, Mental Health Bill. It needs to focus on health and on fostering the conditions that foster positive mental health. And it needs to set a pathway to eliminate coercive practices that are detrimental to health. The He Oranga inquiry and the subsequent agreement to repeal and replace the current Act were presented at the Committee on the Rights of Persons with Disabilities in 2022 as evidence of progress towards implementing the Convention on the Rights of Persons with Disabilities. The committee noted those actions as positive progress, but urged in its concluding observation number 26 that the state party ensure that the new mental health legislation embeds the convention principles and standards to ensure that there are no provisions that allow for deprivation of liberty on the basis of impairment or that allow for compulsory treatment. That recommendation is now being accepted by Cabinet for action. The bill does not action the standards of the Convention because it remains centred around compulsion. We acknowledge genuine efforts to better safeguard people's rights, but the proposed new protections have been overlaid onto the existing legislation, which is essentially a substituted decision-making and medical model, and which, notwithstanding reference to Te Tiriti, has clearly not been developed in true partnership with tangata whenua. The bill in its current form therefore fails to spearhead Te Tiriti and the Te Tiriti and human rights transformative change required by the Convention and sought by community. To progress our Te Tiriti and human rights obligations, we need to change the very foundations of the legislation to imagine what a society and system without compulsion looks like, or at the very least, where it is a very limited exception, only permissible when all others have been exhausted. It is not easy to imagine what such a system looks like, but it is what the Convention requires us to do. We understand that there are challenges And I know that there are many individuals or whānau who already try everything to get support and who may be fearful that they will lose loved ones if the threshold for guaranteed support that the current Act represents was raised. I would counter that this illustrates what needs to change. People should not have to relinquish their rights to get support. The positive elements of this bill, such as support for decision-making, peer support, and attention to people's social needs, need to be available early and widely. This could reduce the crisis situations that lead people into the current regime. Transformation cannot happen overnight, but it will never happen if the legislation does not set the vision. Legislation is a key tool for securing the necessary commitment, resources, and planning to make the rights of the Convention a reality. I acknowledge that legislation alone is not enough to guarantee resources. We know that resource shortages mean not all of the requirements under the current Act are met, such as the requirements for an assigned responsible clinician. But without the expectation or entitlement set out in law, there is even less of a chance that they will be secured and no path of recourse for their absence. Our written submission provides examples of rights-based options for providing support and makes detailed suggestions for improvements should the bill proceed within its current parameters. But today I want to leave you in no doubt that our primary recommendation is that you need to draft a new bill that changes the parameters and gets the foundations right, the foundations of Te Tiriti and human rights. The Te Tiriti Foundation expands well beyond what is drafted in Clause 5. It requires substantive partnership, co-design with, and autonomy for tangata whenua in design, delivery, and accountabilities. It would provide for a tangata whenua to autonomously develop Motaranga Māori responses. It would resource whānau to support whānau. That is what was overwhelmingly called for by whānau, hapu and iwi in all of the processes leading up to this bill and affirmed in the Waitangi Tribunal Health Outcomes Report. That is the only way to avoid repeating the disproportionate impact the current bill has had on Māori. A human rights, disability rights foundation for this Act means that the elimination of differential treatment and coercive practices, by which I mean treatment without consent, seclusion and restraint, it means providing support not just to be in the community, but to belong, to have an adequate standard of living and to have support to be involved in decision-making. There are few decisions as vital to our sense of self as those about our own body, our physical and mental health. Yet that is a right removed when people are treated without their consent. A message we heard clearly when we, as part of the independent monitoring mechanism, consulted about our human rights record a few years ago was forced treatment is a threat to mental integrity, to one's very sense of self. Whanakatia, the report of the Abuse and Care Royal Commission of Inquiry very clearly describes the risks arising when people are categorised based on perceived deficit, congregated together, and their will and voice consequently disempowered. A promise to do things differently was part of the apology to survivors. This bill needs to honour both the recommendations of the CRPD Committee and the Royal Commission's report. It must direct us to shape a future where those abuses can never happen again, a future that starts with and advances people's rights to liberty, to consent freely given, and to the integrity of one's very self. Thank you.
Excellent. Thank you very much. I don't see any questions from the committee, but I do just want to thank you for your very comprehensive submission, both orally and in written format. So thank you very much, and thank you to your team.
Kia ora, thank you.